You feel perfectly fine going about your normal daily routine, but your blood pressure readings keep coming back high? So many people feel completely healthy. No chest pain, no dizzy spells. Yet their heart, brain, kidneys, eyes, and blood vessels may have been silently enduring dangerous levels of strain for a long time. In this video, we are going to explore exactly how high blood pressure quietly damages your body, which red flags you should never ignore, and when it is time to contact your doctor immediately. The real danger is that high blood pressure rarely gives you any immediate warning signs. But with each passing day, that ongoing pressure in your blood vessels forces your heart to work overtime, makes it harder for your kidneys to filter your blood, and leaves your brain highly vulnerable to serious complications if left unmanaged.
Discover exactly how high blood pressure impacts your heart and changes your life.
Brain, kidneys, and blood vessels, even when your body isn't showing any obvious symptoms. You'll also learn why this condition needs regular monitoring, which warning signs you should never ignore, and when it's time to talk to your doctor for the right guidance. But first, let me share a story I came across about an older woman in her early 70s, living alone out in the suburbs. Every morning, she'd still brew her coffee, water the plants on her front porch, and drive down to the local grocery store. She had no chest pain, no dizzy spells, so she always assumed her health was just fine. Only, recently, she was getting tired more easily, not sleeping deeply, and waking up with a heavy feeling in her head. When her family bought her a home blood pressure monitor, the readings came back high, day after day. Only then did she realize her body had been sending her signals all along. So, what is actually happening inside the body? Blood pressure is simply the force of your blood pushing against your artery walls as your heart pumps it throughout your system. When this pressure is chronically high, your heart has to work much harder to push that blood. Over time, your blood vessels can become stiff and less flexible, making it even harder to keep your blood pressure under control. Your kidneys take a hit too, because they rely on healthy, delicate blood vessels to filter your blood and regulate water and sodium levels. As for the brain, prolonged high blood pressure significantly increases the risk of serious complications, like strokes. The crucial takeaway here is that many of these internal changes don't produce any obvious symptoms right away. That's why checking your blood pressure regularly and tracking your numbers over time is far more reliable than waiting until you actually feel sick. But here is what so many people overlook. High blood pressure isn't just a number on a machine. It is a major red flag signaling that your heart, blood vessels, kidneys, and brain are being subjected to daily, repeated stress, even while you are just going about your normal routine. Let's dive into the first organ, widely considered the central powerhouse of the body, the heart. High blood pressure forces your heart to work harder every single day.
Picture a 74-year-old man
who still takes his morning walk around the neighborhood. He still drives himself to the grocery store, mows the front lawn, and considers himself much healthier than most guys his age. But over the last few months, he started noticing a difference. Just climbing a short flight of stairs left him needing to pause and catch his breath. At night, when he lay down, he occasionally felt his heart pounding heavier than usual. He brushed it off, thinking, it's just part of getting older. But after checking his blood pressure several days in a row, the numbers were consistently high. That's when it hit him. His heart had likely been working in overdrive for a long time. When blood pressure remains high over time, your heart has to generate more force to pump blood through your vascular system. Think of it this way. To move water the same distance through a plumbing system, if the pressure inside the pipes is too high, the pump has to work much harder. Your heart is exactly the same. Every single day, it constantly pumps to deliver blood to your brain, kidneys, muscles, and other vital organs. If your blood pressure is chronically high, your heart is forced to endure this extra workload for an extended period. This can increase the risk of your heart muscle thickening, gradually weakening, or leading to coronary artery issues. The tricky part is that this process usually doesn't cause any obvious pain right away. So many people only find out during a routine checkup or when tracking their blood pressure. Pay close attention if you are getting tired more easily during your walks, feeling more winded climbing stairs, or occasionally noticing a strong heartbeat even while resting. These signs don't automatically mean it's high blood pressure, but if they keep happening, you shouldn't ignore them. Take your blood pressure at home at the same time every day. Before you take a reading, sit and rest for at least 5 minutes. Don't talk. Avoid checking it right after having coffee or exercising. Keep your arm at heart level, and make sure you're using the right-sized cuff. If your numbers are consistently high, or if you experience chest discomfort, shortness of breath, or unusual fatigue from light activity, bring it up with your doctor at your next visit. Monitoring it early gives you a clearer picture of your body and helps you find the right management plan. The brain. High blood pressure can increase the risk of cerebrovascular complications. When it comes to the brain, the biggest trap is waiting for a severe headache, extreme dizziness, or other obvious signs before taking it seriously. But high blood pressure doesn't always announce itself with dramatic symptoms. When the pressure inside your blood vessels is chronically high, the arteries delivering blood and oxygen to your brain can be damaged over time. This can significantly increase the risk of cerebrovascular complications, especially for older adults or those with diabetes, high cholesterol, a history of smoking, or prior cardiovascular issues. Because of this, feeling perfectly fine can sometimes cause patients to ignore the very window of time when careful monitoring is needed the most. But here is the detail many older adults easily overlook. Having no headache does not mean your blood pressure is in the safe zone. Some people have sky-high readings, yet they are chatting, eating, and walking around the house just like any other day. That is exactly what tricks them into thinking it's nothing to worry about. Meanwhile, your brain is an organ that demands a steady, stable blood flow every single minute. If your blood pressure is frequently high, the large and small blood vessels feeding your brain are enduring prolonged stress that you won't feel right away. Therefore, the crucial question isn't, do I have a headache? But rather, are my blood pressure readings consistently high day after day? That is the true red flag that needs your serious attention. If you frequently see high readings, don't just take the measurement and forget about it. Keep a log of the date, time, your blood pressure numbers, heart rate, and the context of the reading. For example, right after waking up, after having coffee, or post-workout. Bring this log to your next doctor's appointment so your physician has the full picture to evaluate your trends. If high blood pressure is accompanied by a sudden new headache, blurry vision, difficulty speaking, unusual weakness, chest pain, shortness of breath, or sudden confusion, seek emergency medical help immediately, like calling 911 or going to the nearest emergency room. These are not signs you should try to wait out at home. For older adults, the key isn't trying to play doctor and guess the cause, but rather giving your healthcare provider the right information so you can get safe and appropriate guidance. Remember, managing your blood pressure is a lifelong partnership with your medical team. Small daily choices, like eating wholesome foods, staying comfortably active, and actively reducing stress, will strongly support your prescribed treatments. Taking proactive control today protects your independence and helps preserve your vital cognitive health for the future. The kidneys. High blood pressure can make it harder for your kidneys to filter your blood. Your kidneys do far more than just produce urine. They act as your body's filtration system, cleaning your blood and regulating water, sodium, and essential minerals. To do this heavy lifting, your kidneys rely on a massive network of tiny, delicate blood vessels. When your blood pressure remains high over time, the pressure inside these vessels skyrockets. Eventually, these tiny blood vessels can become damaged, making your kidneys much less efficient at filtering out waste. When your kidneys aren't functioning optimally, your body struggles to balance fluids and sodium, which in turn drives your blood pressure even higher. It becomes a vicious cycle between your blood pressure and your kidneys. The scariest part? Your kidney function can slowly decline without giving you a single obvious warning sign early on. But here's a crucial fact many people don't realize. Your kidneys aren't just taking a hit from aging or blood sugar issues. Chronically high blood pressure is actually a major culprit. You might be using the bathroom normally, feeling no lower back pain, and noticing no obvious swelling, leading you to assume your kidneys are perfectly fine. However, a decline in kidney function is often only caught through routine lab work, like a blood or urine test. If you've been dealing with high blood pressure for years, are currently on blood pressure medication, or also manage diabetes, make it a point to ask your doctor about your kidney health at your next routine checkup. Specifically, ask if you need a blood test, a urine test to check for protein, or to have your eGFR, estimated glomerular filtration rate, evaluated. In the meantime, keep taking your blood pressure at home, logging the date, time, your numbers, and your heart rate. Bring this log to your appointment so your doctor can clearly see your trends and guide you on the best next steps. The eyes. High blood pressure can damage the tiny blood vessels in your eyes. Picture a 6-8-year-old woman who starts noticing the text on her smartphone getting a bit blurry. Every morning, she still reads messages from her kids, checks her daily pill schedule, and reads the labels on her prescription bottles sitting on the dining table. But lately, she has had to hold her phone further away, turn up the room lights, and sometimes even misreads the dosage on her medication labels. She just brushes it off, thinking her eyes are simply getting older. But during a routine eye exam, her doctor specifically asks about her blood pressure because these vision changes require early attention. Your eyes can also be heavily impacted when your blood pressure remains chronically high. The reason is that your eyes are filled with countless delicate blood vessels, especially in the retina, the tissue at the back of your eye that helps you focus on images clearly. These tiny vessels require a steady, consistent blood flow. When your blood pressure is constantly elevated, the pressure on these delicate vessels inside your eyes spikes as well. Over time, they can become weaker, narrower, or less efficient. When this happens, your eyes don't receive an even supply of blood and oxygen, leading some people to experience blurry vision, difficulty reading fine print, or fluctuating eyesight. But here's the crucial takeaway. Not all blurry vision is caused by high blood pressure. Older adults can also experience blurry vision due to cataracts, dry eyes, diabetes, medication, side effects, or a host of other eye conditions. That's why you should never try to self-diagnose at home. If you've had high blood pressure for years, or if you manage high blood pressure alongside diabetes or high cholesterol, you need comprehensive, regular eye exams. During a dilated eye exam, your eye doctor can actually look directly at the tiny blood vessels in the back of your eye and see if there are signs that need closer monitoring. Simply put, controlling your blood pressure isn't just good for your heart and brain. It is essential for protecting your long-term vision, and this is exactly why you shouldn't just write off vision changes as a normal part of getting older. If you've recently found it harder to read, noticed more blurriness, or needed to turn up the lights just to see clearly, pay closer attention to your blood pressure numbers. Your eyes do far more than just help you see. In many cases, they serve as a clear window, revealing that the tiny blood vessels throughout your entire body might be crying out for more care. The entire vascular system. High blood pressure puts long-term strain on your blood vessels. To make it easy to remember, use the 5-point rule when thinking about high blood pressure. Number 1 is the heart. If blood pressure stays high, your heart may have to work overtime every single day. Number 2 is the brain. Frequent high blood pressure can increase the risk of cerebrovascular complications, even if you don't have an obvious headache. Number 3 is the kidneys. Your kidneys need plenty of healthy, tiny blood vessels to filter your blood, so chronic high blood pressure can silently impair their function. Number 4 is the eyes. Vision changes shouldn't just be chalked up to aging, as the delicate blood vessels in your eyes can also take a hit. And number 5 is the entire vascular system. Your blood vessels deliver blood to every single organ, so when the vessel walls are compromised, many other parts of your body can suffer as a result. Just remember this quick summary. Your heart needs its workload reduced, your brain needs protection, your kidneys need routine screening, your eyes need monitoring, and your entire vascular system needs long-term, stable blood pressure control. High blood pressure is nothing to be ashamed of, and it certainly doesn't mean it is too late to start taking care of yourself. It is simply vital health data that your body is trying to send you. When you know your numbers, log them consistently, and discuss them with your doctor, you are taking a highly responsible step for your own well-being. Many older adults are actually afraid to check their blood pressure because they dread seeing a high number. But avoiding the cuff doesn't make the problem go away. Knowing early gives you peace of mind, helps you build a clear action plan, and drastically reduces the risk of future complications. Don't look at your blood pressure monitor as a source of anxiety. See it for what it is: a powerful tool to help you understand your body and protect your long-term health and independence. Stick around for the next segment, because we are going to dive deeper into the subtle signs that many older adults tend to overlook. Feeling winded from light activity, sudden new headaches, blurry vision, trouble sleeping, or consistently high readings day after day. These signs don't always mean you are in immediate danger, but they are absolutely reasons to monitor your health more closely. And in my next video, I will show you the exact step-by-step method to take your blood pressure at home correctly, minimizing errors so you get the most accurate readings every single day. Before we wrap up, let's quickly recap the 5-point rule for high blood pressure. Your heart may be forced to work overtime. Your brain demands a steady blood flow and needs careful attention when readings are repeatedly high. Your kidneys need routine screening because their delicate vessels can be silently damaged. Your eyes shouldn't be ignored when you notice vision changes. And your entire vascular system bears the brunt of that daily stress when your blood pressure isn't properly managed. Having high blood pressure is absolutely nothing to be ashamed of. Think of it as vital health data. When you check your blood pressure regularly, log your numbers, track your trends, and have open conversations with your doctor, you are taking proactive, safe control of your own well-being. Don't wait until you physically feel exhausted or sick to start caring. Many of these internal changes start incredibly small, which is why early monitoring is so incredibly valuable. If you only take away one thing from today's video, let it be this: a lack of symptoms does not mean high blood pressure isn't harming your body. Take a look at your readings over the last few days. If those numbers are consistently high, bring your log to your next doctor's appointment so you can get the right guidance. If you have a parent, a spouse, a sibling, or an older friend who is navigating high blood pressure, please share this video with them. And in our next video, we will dive deeper into how to take your blood pressure at home the right way so you can avoid the most common mistakes that throw off your readings. See you there.